One of the most significant developments in women's health care is the possibility of making a birth control pill available over the counter. This means that women could buy it without a prescription from a doctor, just like they can buy painkillers or allergy medications. This could increase access and affordability for millions of women who want to prevent unintended pregnancies. The FDA advisory panel unanimously endorsed making Opal, a progestin-only birth control pill, available over the counter for the first time. Opal is a type of hormonal birth control pill that prevents pregnancy by thickening cervical mucus to keep sperm from reaching an egg. It is also known as a mini pill, because it contains only one hormone, norgestrol, unlike most birth control pills that contain both estrogen and progestin. Opal has been approved by the FDA as a prescription drug since 1973, but it is already available without a prescription in some other countries, such as the United Kingdom. If the FDA approves Opal for over-the-counter availability, it would be the first birth control pill to be sold on U.S. shelves without a prescription. The FDA advisory panel voted 17-0 in favor of making Opal available over the counter, despite some concerns from FDA officials about the quality of the data used to support the switch. The FDA officials questioned whether women, especially those with low literacy skills, would be able to understand the drug's instruction label and use it correctly. They also wondered whether users, particularly teenagers, would know when to seek medical help if they experienced side effects, such as vaginal bleeding. However, the panel members said they believed that most women could determine on their own whether Opal was appropriate for them and that they trusted women to make their own decisions about their reproductive health. They also cited evidence that making birth control pills more accessible could reduce unintended pregnancies and improve public health outcomes. Some panel members also pointed out that even when birth control pills are prescribed, women can still miss doses or forget to refill their prescriptions. The FDA is not required to follow the recommendation of the advisory panel, but it is expected to weigh heavily on its final decision, which is due by late summer. If approved, Opal could have a huge impact on women's health and empowerment by giving them more options and control over their fertility. However, some challenges and barriers may still remain, such as the cost of Opal and the availability of other contraceptive methods and services. Opal is a brand of birth control pills that contains norgestrol, a type of progestin-only hormone that prevents pregnancy by thickening the cervical mucus and suppressing ovulation. Opal has been on the market for 50 years and evidence shows that it is safe and effective, with lower rates of unintended pregnancy than most other over-the-counter (OTC) methods. According to a study by HRA Pharma, the manufacturer of Opal, the pill has a failure rate of 0.5% with perfect use and 2.7% with typical use, which is comparable to or better than other OTC methods such as condoms, spermicides, and emergency contraception. Opal also has fewer side effects than combined birth control pills that contain estrogen, such as nausea, headaches, and blood clots. Opal is currently under review by the FDA for approval as the first OTC birth control pill in the United States. In May 2023, two FDA advisory panels voted unanimously to recommend making Opal available without a prescription, despite some concerns about the quality of the data and the ability of women to understand the instructions. The FDA is expected to make a final decision by late summer 2023. If approved, Opal could have a huge positive impact on public health by increasing access and reducing barriers to contraception for millions of women who need it. Many major medical organizations, such as the American Medical Association and the American College of Obstetricians and Gynecologists, support OTC use of birth control pills. They argue that women can self-screen for contraindications and that regular visits to a healthcare provider are not necessary for safe and effective use of the pill. However, some challenges and questions remain about how Opal will be implemented and regulated as an OTC product. For example, how will the cost and insurance coverage of Opal be affected by its OTC status? Will there be any age restrictions or limits on how many pills can be purchased at a time? How will Opal interact with other medications or supplements that women may take? How will women be informed about the benefits and risks of OPIL and other contraceptive options? These are some of the issues that need to be addressed before OPIL can become widely available and accepted as an OTC birth control pill. Until then, women who are interested in using OPIL should consult their healthcare provider or pharmacist for more information and guidance.